how that includes the IT band, but also these outside hip muscles and even this little bit of muscle on the front of the IT band, and some ways to maximize your time spent foam rolling. So next I want to talk about the inside of the leg. So these are the adductors, okay? They are going to cross the knee and they're going to come up. It's kind of this chunk of a section here, all right? They're going to come up and attach kind of in your groin from the front, sort of running all the way to the back, all right? There are some that attach more towards the back, the middle, and the front here. The reason these are important is because of the way they attach to the pubic bone in the front of the pelvis. If they're tight, okay, if they're tight asymmetrically, then they can do some tilting this way or this way asymmetrically, which can affect how your hips are functioning. And if they're both tight, they can do almost some pulling forward. So if they're tight here through the pubic bone, then they may be kind of pulling your pelvis this way, which is affecting how your hip is able to align and function. So this is an area that I think a lot of times gets overlooked. We spend a lot of time, oh, my IT band, this and that. These muscles tend to get overlooked. I've been dreading this a little bit because one, I'm gonna look pretty silly showing you this, and two, it's not a very comfortable area to foam roll, I'll be honest. Just like the outside, but you can control how much pressure you're putting on. You can control the amount of pressure with the kind of foam roll that you're using. So some discomfort is to be expected, but it should not be painful. And also I want to mention that in this region, you know, especially right along here, this is called the femoral triangle, you have a large artery. So you do want to be sort of gentle with this area so you're not creating a lot of bruising. I remember back when this, do you guys remember the fascia freer? Anyway, I was at a salon and all the women were using the fascia freer, and they were doing it a lot on the inside leg. It looked like someone had taken a baseball bat to their leg. They had so much bruising. But that was where, you know, it was supposed to be loosened up. So just be gentle with yourself. We're not looking for lots of bruising or pain. We're just trying to get some mobility and fluidity within the fascial system, around the muscles and between the muscles, so that you have a better alignment for the hip, and then better muscle function, and then better control when you're doing what you want to do, hiking, running, whatever it is. Okay, so these muscles I mentioned attach up in the groin, and then some of them attach along the thigh bone and some cross the knee. So you take your foam roll long way with you, and I usually start with my knee bent, and I'm kind of starting right at the edge of the knee, and then you're just going to allow your leg to kind of roll out. If you had some back pain or trouble with like a rotation or extension in your low back, then this might be something to avoid. It might not feel very good, but it is kind of a nice way to get at these muscles. So I'm just slowly rolling down and out along here, and I'm looking for areas that are maybe a little more tender or a little more tight. Okay, and if you can get all the way up to where the muscle is kind of coming into the bone, then awesome. All right, and then you can kind of play with which aspect of the muscle bulk you're getting. So more towards the back, a little more towards the front, this way. If you find a tight spot, you can spend a little extra time there. You could also rotate your leg up and down to try to loosen that area up a little bit more. And the other thing you can play around with is whether your knee is bent or straight. You could even bend and straighten it as you're kind of going to different areas and spots that you're mobilizing, or you could just keep it straight and do some rolling along there. Okay, so because that is kind of intense and it just may not be comfortable for you, I want to show you one other move. This is a functional movement pattern that I learned from the Institute of Physical Art. And it's for helping to open up your hip and relax some of these muscles. So if you are able to do the foam roll, then this is a nice thing to do afterwards. So we're working a little more from mobility, moving into neuromuscular control. And if the foam roll is just too intense for the inside of your leg, then this is an alternative to try to kind of actively start releasing this area. So you're going to lay on your stomach if you're able to, and then you're going to just bring the leg out to the side here, kind of frog legging it, and then you're going to try sliding the leg up, and what you're while you sort of keep the pelvis from rising up. So if I don't try to do that, what might happen is if I have tight hips on the inside, my hip is going to rotate up in order to let me flex the hip up. That's not what I want. I want you to try to keep this down and bring the hip out to the side. And when I do that, I get a little more stretch in the front. And then just try sliding that leg up and down a little bit while you keep your pelvis relatively level. Okay? And you could play around here with straightening and bending the knee. I do not have a lot of flexibility in that region, but that's an option too. Okay? So you got a mobility and a functional movement pattern to help use that mobility. And in the next videos, we'll go towards what you can do to kind of help mobilize more of these back or posterior tissues. Okay? Thanks for watching. Appreciate it.